Good morning. This is the third video of infrastructure of class 12. Here we are going to study about the different health systems in India. What is the condition of healthcare in India? Now, if we start with this in the healthcare sector, the first thing which we study is health does not mean absence of any disease, but also the ability to realize one's potential. It is a yardstick, one's well-being. Health is the holistic process related to overall growth and development of the nation. Now, how to study the condition of health, scholars assess people's health by taking indicators, and these indicators are infant mortality, maternal mortality rate, life expectancy, nutritional level, communication and non-communicable diseases. So these are the different parameters by which we study the condition of health of a country. The health infrastructure is very important because development of health infrastructure ensures a country of healthy manpower for the production of goods and services. If we recollect in the chapter on human capital formation, we had done that there are two important things. A human being can be turned into a human capital by the use of education and health. Education is his ability and health improves his efficiency. A healthy person can do the same work in a much better way than an unhealthy person. So the development of health infrastructure ensures a country of healthy manpower for the production of goods and services. हमने बहुत सारा पैसा लगा दिया, हमने लेटेस्ट मशीन्स लगा दी, लेकिन हमारी मैन पावर जो है वो हेल्दी नहीं है, तो वो काम नहीं कर पाएगी. What are the different components which we study under health infrastructure? It includes hospital, doctors, nurses, paramedical professionals, beds, equipment, well-developed pharmaceutical industry, etc. So if we look at the health system in India, we find that in India, the healthcare system is a three-tier system: the primary, secondary, and the tertiary healthcare. The primary healthcare includes the education concerning preventing health problems and method of identifying them, preventing and controlling them. Promotion of food supply and proper nutrition, adequate supply of water, basic sanitation, maternal and child health care. Immunization against major infectious diseases and injuries, promotion of mental health and provision of essential drugs. Primary healthcare centers, community healthcare centers, and sub-centers which are set up in rural areas and small towns are generally managed by a single doctor, a nurse, and a limited stock of medicines. This is the primary or the first healthcare system. In the second or the tertiary healthcare system, hospitals which have better facilities for surgery, there is X-rays, electrocardiograms, ECG. These are better than the primary healthcare and provide better facility. They are mostly located in district headquarters and big towns. When the condition of the patient is not managed by the primary healthcare centers, they are referred to the secondary or tertiary healthcare center. Now, in the tertiary healthcare center, all the hospitals which have advanced level equipment, medicines, undertake complicated health problems. This includes premier institutions which not only give quality medical education, research, but also provide specialized healthcare. Some of them are All India Medical Institute of Medical Sciences, Delhi, Postgraduate Institute, Chandigarh, PGI, Chandigarh, Medical Education and Research, Pondicherry, etc. Now, let us study what is the state of health infrastructure in India. In India, where health infrastructure is concerned, the government has constitution obligation to guide and regulate all health-related issues such as medical education, adulteration of food, drug, poisons, medical profession, vital statistics, mental deficiency, and lunacy. The union government or the central government evolves broad policies and plans through the Central Council of Health and Family Welfare. This collects the information, gives financial and technical assistance to state governments, union territories, and other bodies for implementing these programs throughout the country. The healthcare growth in India. What has been the healthcare growth? Now, if we look at it, over the years, The number of hospitals have increased from 2,000 to 25,000 government hospitals. The beds, 1,17,000 to 7,13,000. Dispensaries have increased. Primary healthcare centers have increased. Then the sub-centers have increased. This shows that there's a lot of improvement. The National Commission on Macroeconomic and Health, Ministry of Health, gave us various data inputs to which made this possible. Now, what we find is that whatever the government has done, it has done enough, but still it is not sufficient. So private sector health infrastructure is a parallel branch which has come up, and private healthcare sector is providing most of the facilities which others do not have. The primary healthcare structure, this includes the private sector has grown up. A study reports that 70% of the hospitals run in India are by the private sector. They control 2/5 of the beds available, 60% of the dispensaries, provide healthcare, 80% of the outpatients. In recent time, private sector has been playing a dominant role in provision of medical education, technology, diagnostics, manufacture and sale of pharmaceuticals, hospital construction, and provision of medical services. If you look at it, there are a number of private hospitals, private hospitals, they are private institutions giving medical education, promoting doctors. But still we find that there are no regulations in the private sector. Some private practitioners do not have are not even registered doctors and are quacks. Due to this, many non-resident Indians and industrial pharmaceutical companies have set up super specialty hospitals. And one very important concept is the concept of medical tourism. Medical tourism means that people are coming from other countries to take medical help from our country. Now, the Indian system of medicine is a very old system. This is called as Ayush. This includes Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. Hence, it is given this name. This Indian system of medicine consists of 5 different branches, and a lot of development is done in the field of Ayush. There are around 5,000 Ayush hospitals. Dispensaries have increased. Doctors, BAMS practitioners have increased, but still there are certain problems with ISM, that is Indian system of medicine. People do not have full faith in them, and little has been done for their promotion. Critical appraisal. Let us critically see what is the development in the healthcare sector, and we find that the expenditure on healthcare is very low. Expenditure on health sector is 3.7% of the total GDP, and this has been repeatedly shown during the first and the second wave of COVID. The poor health indicators that 1/5 of the world's population bears a frightening 20% of the global burden of diseases. GBD is an indicator used by experts to find out the number of people who die prematurely due to a particular disease. 2/3 of the GBD, known as total burden of diseases, was caused by non-communicable diseases associated with heart, respiratory system, lungs, kidney, obesity, and lifestyle. Out of 4.1 million early deaths occurring globally due to air pollution, 1.1 million occur in India. As you have seen, we have people of asthma. Asthma now, a large number of people are dying because of asthma, cancer, etc. The inefficient public health system. Although the government is trying a lot, but still it is inefficient. The main problem is seen between the rural and the urban divide. In rural area, the healthcare facilities are much limited compared to the urban areas. 70% of the population lives in rural areas, but only 1/5 of its hospitals are located in rural area. Rural area has about half the number of dispensaries. Then, as far as the hospitals are concerned, very few people are able to assess the hospitals in rural area. Around 0.36 hospitals for every 1 lakh people, whereas 3.6 hospitals for in the urban areas. The primary health centers do not have X-ray or blood testing machine. which is a basic health care. The states like Bihar, Madhya Pradesh, Rajasthan are much lagging behind in healthcare. Villagers do not have access to any specialized medical care like pediatrics, gynecology, anesthesia, and obstetrics. Then there is a rich and poor divide. That was the rural-urban divide. Here is a rich and poor divide. We find that the rich people are able to assess accessibility to better healthcare services, which are of the private institutions, whereas the poor people have to rely on the government hospitals, which do not have sufficient facilities. So the poor are driven to private hospitals, which make them indebted forever, else they are left to die. If we look at the poor status of women, we find that the status of women health is not given any importance. They suffer many disadvantages as compared to men in the area of education, participation in economic activities, and healthcare. Especially the child sex ratio is declining due to female feticide. The health of the women is also not very good. 5% of the girls between 15 to 19 years have already born child at least once. This makes the married women very, very weak. Their problem of anemia, nutritional iron deficiency. Then we come to brain drain. We find that most of the students, those who are studying in recognized medical colleges, they still we have short of doctors in rural areas because most of the students, they prefer to go to other countries in search of better monetary prospects and better growth. Massive scale of health care has been started recently. World's largest healthcare program, Ayushman Bharati, has been launched, which has benefited almost 10 lakh patients already. Medicines are affordable at prices, generic medicines are affordable at Pradhan Mantri Jan Ayushadhi Kendras. Prices are of essential medicines, cardiac stents, and knee implants have reduced. Now there are 21 AIIMS operating, already established in 14, announced since 2014, and 22nd AIIMS to be set up in. The 22nd AIIMS has to be set up in Haryana. All these things, we can say that infrastructure, both economic and social, is essential for the development of the country. It is a support system which directly influences the economic activities by increasing the productivity as well as production. During the last 7 decades, India has had made considerable progress in building infrastructure, but still it is very little compared to the world. The rural areas do not get enough roads, telecommunication facility, electricity, schools, and hospitals. As India moves forward towards modernization, the increase in demand for quality infrastructure is there, and we hope that the new governments would continue to do the same.